Good afternoon, everyone. We'll be getting started momentarily. We are allowing the audience to merge. All right, Felicity, we're ready to get started.
Thank you, Allison. Good afternoon, and thank you for joining us for an overview of the current state of infection prevention and control in adult day centers. Next slide, please. Before we get started, just a few housekeeping items. Everyone is currently muted and in listen-only mode. Today's session is being recorded, and you will receive an email with a link to the recording. Q&A is available throughout the course of this presentation, so please use the Q&A icon at the bottom of your screen to type in your question at any time. You may also click the raise your hand icon if you'd like to be unmuted to ask your question. We will also have time for questions at the end of the presentation. If you encounter any audio challenges, please click the audio settings and proceed from there. Next slide, please. Next slide, please. Please meet our HQI project team. I'm Felicity Wood, consultant, and Allison Spangler, project manager, is also on the webinar with us today. Next slide, please. I'm also pleased to announce a special guest of our presentation, Brianne Raymond, an infection preventionist from the Virginia Department of Social Services. VDSS is a project collaborator with HQI to ensure the policies we develop through this project reflect the best practices in current infection prevention protocols. Next slide, please. Leading Age Virginia, an association of not-for-profit aging service organizations serving older individuals in a variety of settings, including adult day centers, has received Centers for Disease Control funding through the Virginia Department of Health for this project. Leading Age Virginia has partnered with HQI, a Richmond-based independent nonprofit consulting organization, helping healthcare providers and communities to improve healthcare delivery and patient outcomes. Our project goals for this grant project are threefold. First, we're developing model policies that reflect standards and regulations in the area of infection control and prevention and our best practice. We're ensuring this by having VDSS, Division of Licensing, review all policies newly developed prior to finalizing them to verify that the policies do not conflict with or make it more difficult to comply with adult day center standards. We'll also provide policies that can be easily adapted at all adult day centers throughout Virginia. And we're ensuring this by having a work group that's comprised of a diverse group of adult day center representatives who have been meeting weekly to develop the model policies for this project. The work group representatives are a voice for the unique perspectives for the participants and the families that you serve and the staff you employ. Finally, we will provide implementation support for these policies. We will also host monthly office hours, which will serve as a forum for asking questions and receiving just-in-time technical assistance from our project team. We'll also provide webinars throughout the policy development process, both to share the newly developed policies and to provide assistance with implementation and sustainability practices. And once we've attained these goals, success includes all Virginia licensed adult day centers having consistent policies, which will assist the centers with infection prevention and response to threats posed by infections. Next slide, please. The steps we will take to achieve our goals are outlined here, and our focus during today's presentation is on the first point. We will be providing you an overview of the current state of infection prevention policies and processes in adult day centers. Next slide, please. To determine what policies and data exist currently, we conducted a comprehensive literature review and environmental scan to not only identify existing resources, but also to provide an evidence-based foundation for this project and to determine which policies needed to be developed. We connected with the National Adult Day Services Association, as well as other state-level associations to gather information on this topic. We reviewed professional journals, articles, and made phone calls to providers and researched infection prevention programs in place in other settings, like assisted livings, nursing homes, and hospitals. So what did we find from our comprehensive search? Well, we found that a model set of policies specific to adult day centers does not yet exist. Through this thorough literature review and environmental scan, demonstrated these shortcomings of existing policies, data, and resources, and further upheld the need for a robust set of infection control policies specific to adult day centers. Despite this finding, we found that many of the needed policies and resources for other adult day centers could be derived from other settings and applied to these specific intricacies unique to the adult day center setting, providing a significant starting place for the goals of this project. And it is with this basis that the work group is hard at work developing much needed policies to support you in your operations. Next slide, please. As mentioned previously, Brianne Raymond is with us as a special guest. Brianne is a nurse, a health practitioner, and a project manager. She's a recognized healthcare leader and has served as a healthcare industry representative to the United States Citizenship and Immigration Services, providing healthcare insight to guide development of congressional legislative policy. She's also a member of the American Public Health Association and Women in Healthcare Washington, D.C. chapter. Brianne currently works as an infection prevention consultant team member at the Virginia Department of Social Services Epidemiology Laboratory Capacity Grant, where she conducts infection prevention assessments for adult facilities, principally in Northern Virginia. It is through this work that Brianne has been able to determine best practices for infection prevention at adult day centers, and we're pleased to welcome her to this forum to share that information with us today. Brianne?
Thanks, Felicity. Good afternoon, everyone. Very excited that you've all chosen to attend today's webinar. For those of you that may have attended last Wednesday's webinar, where we talked about infection prevention best practices, I'm sure you may be wondering, what's the difference in what we're presenting this afternoon versus last Wednesday? The focus for this afternoon is going to be on best practices that we're seeing across the Commonwealth of Virginia, specifically for adult day healthcare centers, and what we've seen in best practices that are chosen not to be implemented or potentially just those that haven't been implemented. But I think it's a great linkage to Felicity and the work that HQI is doing in developing policies. What is different about adult day centers in the Commonwealth of Virginia is there really aren't any existing policies or guidance that exist at the moment. Through the work that HQI is in the process of completing, the goal is to have available to adult daycare centers policies that you can choose to implement in a really streamlined fashion. And then hand in hand with that would be then some of the best practices that we're going to discuss today. They may not seem quite different than what we discussed Wednesday, but again, through the work that the IPC team has been conducting throughout the Commonwealth, we've been able to collect data. And through the data that we've collected, we're able to determine best practices that have been implemented in either of the two settings that we've discussed. So as we move through the presentation, what you will see is that we have information that demonstrates in adult daycare centers where you're missing, where the gaps are from an implementation of some of these best practices. So moving on to the next slide. Standard VDSS mission slide. The goal of VDSS is to design and deliver high quality human services that help Virginians achieve safety, independence, and overall well-being. And I think that's true amongst most of the agencies for Virginia. We are also part of the Virginia Long-Term Care Infrastructure and Pilot Program from a grant awarded to VDSS from the Virginia Department of Health, VDH, through funding through the CDC. On to the next slide. So as in last Wednesday's webinar, we are going to be speaking in different sections, organizing best practices in relevant groupings, starting though with an overview of why and how we are approaching this. What may seem quite similar, again, are these different groupings, except there's a missing one, and we'll talk about that as we get through the information. But just to make sure that there's clarity, again, we're going to be speaking very specifically about adult day care centers today. So moving on to the next slide, Allison. So again, using a similar structure to today's approach, to today's presentation, we're going to talk about why the best practices that we're focused on have an impact. How do they impact infection control? What's the why? And what's the how? What are the implementation strategies to be successful in implementing the best practices that we're talking about? So moving on to the next slide. As an overview, there are some trends that we're seeing as it relates to best practices. So the groupings of audit and monitoring, disinfecting agents, and signage create an ability to cluster some of the best practices that we're seeing. But even throughout those three groups, we've seen some trends that we think are helpful to identify in coming up with strategies that may be specific to your facility. And the trends that we're seeing kind of really bunch around, again, auditing and training, interestingly enough, but taking that to the next level of application of, are you providing feedback once you've audited and monitored some of the best practices we're talking about? And then is that leading then to what we would see as the next step, which is using that information to develop staff education so that you are enhancing some of the best practices. Specifically, we're going to talk about cleaning and disinfecting agents, but really that concept translates across most of the best practices that we're talking about today. And then just to round things out, strategic use of signage and visual aids, I think that's in support of promoting the education that's been provided, as well as enhancing and solidifying those infection prevention behaviors. So moving on to the next slide. I think we talked a little bit about this before. Moving on to auditing and monitoring. And then on to the next slide. So what's the infection prevention best practice we're talking about here, and what's the impact? So the infection prevention best practice is the routine audits of staff adherence to infection control behaviors. And the context here is specifically as it applies to hand hygiene. And we think about an audit, what's the value from an infection prevention perspective of performing these audits? As we talked about with trends, it provides the opportunity for education and training so that you can identify that. But through that audit, you're also able to figure out what kind of opportunities are there to help improve this practice, this behavior across your staff. And then it also provides insight into what kind of behavioral changes will help support some of the improvement opportunities that have been identified. And again, how is that going to impact not just the education and training delivery, but what the outcomes of that education and training programs will be? And the final aim of an audit really is at a more facility level to enhance compliance with infection prevention behaviors, and ultimately to decrease the likelihood of transmission of different bacteria, pathogens, that ultimately will lead to reduced illness of both your participants as well as your staff. And the reason that we chose to focus on this, as you can see from the data on the bottom of the slide, is when our team is out in the field performing our assessments, this is one of our routine best practices that we evaluate. And what we're seeing out in the field is that about almost 80% of adult daycare centers do not, at the moment, have routine audits of infection control behaviors, such as including hand hygiene. And when we ask this question, we get a variety of different answers. Appreciating that adult daycare centers have a more transient nature to the services that you deliver. And what I mean by that is you have participants that arrive in the morning and leave in the afternoon. And it limits the amount of time potentially that you have to perform some of these audits. And appreciating that when your participants are there, you're busy with them. You've got a lot of activities that you want to squeeze into that short period of time that they're at your facility. But what we would highly recommend as we move on to the next slide is implementation of some of the strategies we're going to discuss here. Again, to be very sensitive and mindful to the operating environment for adult daycare centers, but to see if there's a possibility of, through some of those hours that you're actually operational, to conduct some of the audits, make sure that you're using those audits to provide information back to your staff, whether it be in actual staff records, at a staff meeting potentially, or even through an in-service, and including in that feedback to your staff about the audit observations or the results of it, and then making sure that you're continuing to provide training and education to your staff. And when we think about this, it might be that you need to do this in a formal manner, slightly outside of the facility's operating hours, and I think I would emphasize the and there, have a chance at some point, having your point of control for infection prevention, to do a walkabout and have a chance to observe your staff while they're in the middle of their daily routines. And then when the opportunity presents itself, to pull them aside and give them feedback on what both good and bad, or positive and negative, on what you've observed. And to then make sure that you're solidifying that through formal trainings as well. So we really feel this is kind of the key. I know that we've been so focused on COVID in the past, but hand hygiene really being key to some of the potential outbreaks, such as norovirus, myself just recovering from that this week, that we've been have that circulate out in the community, as well as other potentially contact driven transmissions of different pathogens that may pose a threat to the safety and the health of your facility and your participants. So moving on to the next slide. We move into disinfecting agents. Moving on, Allison. We have a couple of best practices here, but what do you know? We start with audits and monitoring. In this case, we're talking about audits and monitoring of the quality of environmental cleaning and disinfection / disinfecting agents. So what our goals here from an infection prevention and what the impact of this routine audit would be is that you're maintaining the highest level of sanitation in your facility. And appreciating that in adult daycare centers, can be a greater density, so to speak, of your participants or just members in the room, so to speak, so that you have greater proximity or closer proximity with a greater potential for transmission of disease in those environments. And that the levels of sanitation need to be at their absolute highest level to maintain the health and safety of your participants as well as the environment. And also from an impact perspective, yet again, we find that audits and monitoring provide the opportunity to identify additional education and training needs. And just at a very basic level, through those audits and monitoring, you're able to increase the understanding of your staff of proper cleaning and disinfection procedures, as well as knowing that your staff wear a number of different hats throughout the day, having them take greater accountability or ownership of their part in maintaining a healthy and safe environment through the use of environmental cleaning and disinfection. So as you can see, very limited positive response, or very few facilities perform audits and monitoring of environmental cleaning and disinfection, really almost the majority, frankly. Again, very mindful of the fact that you folks are delivering in a very tight timeline to take care of your participants as they are in the facility, but appreciating that there may be some sort of rotation schedule that you have for folks that take on the role of disinfection and cleaning, making sure that there's proper auditing and training of this best practice. So moving on to the implementation strategies. Next slide. It's going to look really similar to hand hygiene in the idea that you need to find the time to provide feedback, audits, monitoring, and feedback to your staff. Again, perhaps in a formal mechanism that exists before or after operating hours, or hopefully in an informal capacity where you're monitoring your staff as they go about their daily routine, and making sure that you've got that training and education to your staff when you identify a need. And in this case, particularly maybe when there's an outbreak, just trying to make sure that you're maintaining the highest level of sanitation within the operating environment. And then moving on to our next best practice, but in between, just a short glance of the chain of breaking the chain of transmission through cleaning and disinfection at a very critical point from the contaminated surface to either your susceptible participants or your staff, making sure that you're able to break that chain of infection at that critical point through proper disinfection and cleaning. And then moving on to the next slide. Very specifically and tactically applied, providing that education so that your staff has the most current and useful information as it relates to disinfection, and also understanding that a good portion of the staff really don't have a working understanding of something called contact time or wet time, which is the amount of time that a disinfecting agent should be left on a surface. So making sure that you have that information both in an education session as well as through signage throughout the facility that lists out what your disinfection agents are and what the proper contact time for that disinfection agent may be. And then making sure that if you're using a very large collection, if you're distributing out from a large collection vesicle disinfecting agents into smaller, like handheld bottles or some other form that's smaller than the original, and you no longer have the contact time listed, make sure that you're actually putting that on those smaller bottles that you're transferring from the larger collection device. And then moving on to the next slide. Again, just making sure that you're training around the handling and cleaning of disinfecting agents. The good news is that we did see some improvement here. Greater than half of the centers are in fact training on this, but still very important for those that are not, that you consider enacting this best practice in the interest of making sure that you're having your staff protected in the highest level. And again, you want to make sure that they're not being exposed to potential harm and that they are then able to use the agents in the manner that is expected with the results that you would expect as well. And then moving on to the next strategies around this. Making sure you're providing education on the need to put on different types of personal protective equipment, such as gloves, such as goggles perhaps, so that you are in the most effective and efficient way preparing, cleaning and disinfecting agents, and make sure that PPE is accessible when agents are being prepared and used, and then making sure you're monitoring staff compliance with the use of PPE when they are cleaning and disinfecting, both as part of the agent preparation process and the actual use of that cleaning and disinfecting agent. And then moving on to our next slide. We're in our last category, which is signage. Signage, again, is something that, interestingly enough, we saw in a very limited capacity being utilized at adult daycare centers. So the impact of that on the next slide is, these are just examples of signage and visual reminders. So then moving on to the next slide. You can see that, again, it's the majority of adult daycare centers that really don't have this up. So the impact of this is that you're missing out on providing the most current infection prevention instructions. You're also missing out on providing information about just the basics of infection prevention on masking, coughing, and the use of hand sanitizer. And it also, the impact is that the restrictions that may exist in other parts of the facility are also being lost in the communication by not having up signage and visual reminders. And then moving on to the implementation strategies that we would recommend on the next slide. We would make sure, we would recommend that during peak respiratory illness periods and or GI illness periods, that signs are posted that remind staff, residents, visitors to adhere to both respiratory hygiene, cough etiquette, hand sanitizing, hand hygiene, again, to ensure the highest level of sanitation in the environment. Making sure that you're posting visual reminders to the staff in common areas like nursing break rooms, the kitchen area, and other staff areas that are PP-free zones. And then when transmission-based precautions are in use, make sure that you have signage that clearly indicates who can go into certain areas, what PPE is necessary, what's the order for donning and doffing of PPE, and that you have different color codes to help signify the different levels of transmission, the transmission-based precautions. Again, moving on to the next slide, Allison, what we've seen with signage is that folks in the adult daycare center, small spaces, understand that you don't want to necessarily take up real estate with signage. On the other hand, really impactful just due to the number of folks that you have in a smaller space and the need to make sure that they have the best understanding of what the expectation might be. So again, posting signs at the entrance and other frequented areas as an implementation strategy, making sure you're staying on top of current recommendations because sometimes they change and sometimes they can change really fast. And then monitoring compliance to the behaviors you're trying to achieve through the posted signage to make sure that it's actually effective. And then in wrapping up, as we run to the end of our time allotted and moving on to the next slide, Allison. We talked again about the different groupings here, starting with auditing and monitoring, but with auditing and monitoring actually is a theme throughout the best practices that we're seeing that were frequently missed in adult daycare centers. Providing staff education, knowledge and use, not only of cleaning and disinfecting agents, but honestly throughout the other buckets that we discussed, that being hand hygiene as well as signage. And then again, finishing up though with the strategic use of signage and visual reminders to educate and promote improved infection prevention behaviors and best practices, which is really the goal of all of these best practices. So hopefully this has provided a little more insight as to, from an adult daycare center, where we see specifically needs to be addressed, that through either the implementation of these best practices, which hopefully are supported ultimately by policy, you're able to really create the safest and operating environment for both your participants as well as your staff. And then in our last 2 minutes, we're going to turn it over to any Q&A.
Bryony, if I can just add a couple more points here. We really are appreciative of your informative presentation and providing us with your findings in adult day centers with infection prevention best practices and implementation strategies. So where are we now with this project? Well, our work group has been meeting weekly since mid-January and working diligently to develop policies. The work group's completed a couple of policies which are in the final review stages and also has several other policies they'll be tackling over the course of the next 4.5 months. Monthly office hours will be starting soon, and an implementation tip sheet will also be available to support adult day centers through their individual center policy adoption process. Throughout the efforts of the work group and the information that Bryony shared with us today regarding infection prevention impact and best practices will be kept at the forefront of policy development. So next slide, please. Here is our HQI project team contact information if you wish to reach out to any of us with any questions. And we will now open up the webinar for any questions that you might have for the panelists.
And just as a reminder, if you do have any questions, you can either click on the Q&A icon and enter your question there, or if you would like to be unmuted, just simply hit the raise your hand and we will take you off mute so you can ask your question. And ladies, there currently are no questions.
Well, thank you so much. We really appreciate your participation, and hopefully we've helped make your life a little easier as you go about making sure you're providing the safest environment for your participants.
Thank you, everyone.
All right, and there currently are still no questions, so we will conclude today's session. Thank you all for joining us. We hope you have a good rest of your day.